Hello, everybody. How is everybody doing? This is the first webinar that I'm holding, and I think I can see here that it's live on Facebook and it's live on YouTube. Um, I just want to see. Let me see here. I want to see if anyone can just entertain me for a second and maybe type something in the comment box. Maybe just type and see if you can hear me. Can people hear me? Can anybody hear me? Should I? It says here that I have some people watching. Well, I really hope that you can hear it. In any case, if you can't, oh, hello, thank you very much for letting me know. Okay, great. So let's get started. It is 1 o'clock, and this is the first of many different series that I'm planning to hold. I do plan to hold these things. Thank you so much for Nancy and Bernadette for telling me that everything here is going well. My name is Dr. Spinati, for those of you that don't know. Some of you do know. And today we're going to be talking about why your teeth will keep getting worse. Now, before we do this, I do want to point out a few things. So you can see here on the bottom left of the screen, you can see where it says Spinati Dentistry Education. So this is the educational series that I'm planning to hold either once a week or every 2 weeks in order to further your education in dentistry so that you can better your oral health and live a better life. Because as you know, oral health is tied to mental health. So here, you can also see that we are the Consumer Choice Awards winners in 2024 and also the Cosmetic Dentist Award winner of 2024. And this is a testament from the community of your vote of confidence for, thank you so much, Nancy, for letting me know that you can hear. But this is a vote of confidence from the community of the job that is being done at Spinati Dentistry, and we thank you for that. So without further ado, let us get started. Now, in today's agenda, in our small amount of time together, my goal is to make a big impact on your oral health in the following ways. And the main thing is to identify the main problem of why your teeth get worse over time. Now, some of you that are watching this, some of you that have registered as well from various points, whether you're watching it on Facebook or if you're watching it on YouTube or even watching it directly here on StreamYard, some of you have gone through certain treatments. So you're a little bit ahead of the curve. But this is to address the main problem as to why teeth, generally speaking, get worse. And to give you confidence that your teeth don't have to get worse over time. And also to give you clarity and a proven solution of how to prevent this damage. Now, I am going to do a special offer and bonus for those of you who stayed all the way to the end. Okay, so this is an educational platform, but I do want to hold your attention. And so I'm going to give you an offer for those that stick around all the way to the end. This is only for those of you that actually stick around all the way to the end, okay? So stick around. That's the main goal here. Now, before we keep going, for those of you that don't know, and maybe for those of you who have met me, you probably don't know this information. So who am I? Who is Dr. Spinati? Well, Dr. Spinati, I graduated from the University of Sydney Dental School in 2015. By the way, this presentation is between half an hour to 40 minutes-ish, okay? So it's probably going to be around 30 minutes, maybe a little bit shorter than that. So just letting you know, it's not going to pass past 2 o'clock for sure. I'm guessing it's going to be around 1:30, maybe 1:35, maximum 1:40, if anyone has questions, and depending on how many people join. So anyway, so University of Sydney Dental School 2015, so which means that I am coming to my 10th year of practice of, over 30, 40,000, 50,000 hours of work. A lot of work has been put towards dentistry. And so I've seen a lot of things. And I love helping others. So you can see here, there's a screenshot there of the video that's currently on YouTube. And this is a campaign that I held back in 2013 in order for me to help raise awareness and funds for people in Syria because of the crisis that was happening. And there was a lot of homeless people that were displaced from their homes. And so then what I did was I pitched a tent in the middle of nowhere. I just pitched a tent. And during the filming process, my boots got wet. And so I had to remove my boots and my socks. And so that's why you can see here I don't have my socks or boots on. And so my my feet were frozen. Literally, they were frozen, and I was planning to do a overnight stay just to kind of simulate what being homeless in Syria feels like, but I couldn't. So I told the cameraman, I said after 3 hours, I said cut this off right now because I feel like my feet are going to get cut off, and I literally couldn't even feel my feet after 3 hours. So that's why I had to do that. But we did raise $20,000 in a matter of 1 month, which was a huge success. And there was a lot of people that got involved in London. University of Western Ontario got involved, Financial College got involved, a lot of students got involved, news media got involved. So a lot of people got involved in order for us to raise these things. And a lot of people donated, this tent, and a lot of people donated a lot of things as well. In 2017, after I graduated and started practicing, me and my friend who graduated with me, also we flew to Greece and to help the refugee crisis there in Greece. So in order for us to help them and to do dentistry, so it was a mission trip. And in 2019, when I first opened Spinati Dentistry, the company gave $10,000. So we were the main donation enterprise for St. Aidan's Church, and so we raised $10,000 in order to support Anova, which is a women's and children's shelter, Jesse's Journey, and money for the church as well. And this was in 2019. As you can see here, that's me giving a speech during the event itself. It was actually very fun and very rewarding. And also, coming along, the segue of me loving to help other people, I did a podcast, and I still do a podcast, but currently it's not as active as it used to be. But this podcast, I said, Discover with Spinati. And it's literally to discover people in the community, in local community and abroad. And as you can see here, this is Ray Prussia. If you've ever watched the show Suits on Netflix, so this is one of the actors from Suits, and he appears in season 9. He is Dr. Lipschitz. He's the psychiatrist for one of the lawyers on Suits. And so he flies from LA and goes to Toronto in order for him to act for Suits. I met him on the plane, as you can imagine, I'm the type of person that, I approach people randomly. And so I approached him because he seemed like a very striking character. And so I approached him, and we became very close friends. And so when he came to Toronto, I drove to Toronto with my film buddy, and then we filmed this podcast. And I filmed a lot of podcasts with a lot of people from London and outside of London. And it's mainly just to help people try to connect with other people and also to inspire others to do things that they otherwise felt a little bit intimidated to do. And this love of helping people spilled over into dentistry. And so, as you can see here, the reason why I'm doing this whole educational process is so that I can help you. So that I can help you and whoever wants to be helped, whoever wants to have better teeth and a better smile and better overall health, kind of enjoy their life better. And so that's the whole point. That's the whole theme of me trying to help other people. And so I love, my love for helping people spilled over to teaching. And so I love to teach others. And so that's all the theme of me loving to help people. And you can see here the picture of me chatting with one of my patients and me giving a lecture here on the right picture there. And lastly, I do work out every day. So if you do follow me on social media, you'll see a lot of pictures there of me going to the gym. It keeps me energized. Now, what is the problem and why are we doing this series? Because I see a lot of problems happening with teeth. And, I would be doing a disservice to you and a disservice to the community if I didn't actually address them. And so over the past 10 years, I've seen a lot of things. I've seen cavities that keep popping up. Okay. And by the way, there's going to be a lot of quote unquote disturbing photos or photos of teeth that are damaged and diseased and whatever. And it's basically to give you the light of what I see, to give you a little bit of education as to why this is actually happening. So a lot of people are getting cavities, and a lot of people don't seem to understand why. And there's a lot of fillings that consistently fail over time. And I'm not talking about, those that fail over the normal period, which is like, let's say 4 to 8 years or 10 years or whatever. No, I'm talking about like year after year or every 2 years. We see a lot of these kind of fillings that fail. And a lot of teeth chip over time as well. You can see here, there's these lines here, these crazed lines here, and there's some chipping happening there, and you can see there's crazed lines here. You can see it here as well with more anterior wear. And along with anterior wear, you can see more extreme cases. And I've seen both of these. And these are two different kinds of patients. And you can see here, there's anterior wear, lower anterior wear here, and this is even more severe. There's something also called compensatory eruption, and I see this almost on a daily basis from people where teeth are basically erupting. And you can see here from an upper perspective, you can see why teeth keep erupting is because they're not meeting the teeth. They're not meeting anything. So they keep erupting so they can meet something. And with that eruption, they start getting bone growth and gum growth that is not natural. You also get something called gum disease. You get gingivitis and periodontitis. And periodontitis simply means the attachment loss. So the loss of attachment. So every tooth has attachment to the gums and the bones. And so when you start getting loss of those attachments, you start getting, gum loss, you start getting bone loss. That also, I see that all the time as well. You can see here a lot of crowding and a lot of, periodontal disease, a lot of inflammation. And here you can see a lot of recession and bone loss as well. You can see a lot of recession, a lot of bone loss, a lot of crowding. Here you can see a lot of bone loss and some root exposure. And these are called diffraction lesions as well. And I see these on a daily basis. And I can say it confidently. I've been seeing it every single day for the past 10 years. I see it every day where people are experiencing these things called diffraction lesions. And we're going to discuss what diffraction lesions are and why they happen. And lastly, I see this all the time too, and dentists see this all the time as well, which is fractures. And fractures of the teeth that are not, obviously not planned, but they happen. And there's a reason why. There's a reason why these kind of fractures accelerate over time. Now, is there a main reason? Now, we know that, these things happen because of several reasons, but is there one outstanding reason as to why these things are happening? And I'm going to say, yes, there is. Everything that I showed you is definitely a multifactorial process, because a lot of people have different kind of eating habits, brushing habits, flossing habits. A lot of people grind their teeth severely. But if there's one big factor, then that would be your bite. And the bite is in the way that your teeth meet together. And how your teeth meet together makes a big difference on your overall oral health and how your teeth actually are preserved for the rest of your life. Now, what does a healthy occlusion look like? Now, here you can see I'm using the word occlusion. And occlusion simply means how your teeth meet together. So that's what a bite is. When the teeth meet together, you bite, and that's what an occlusion is. So you occlude and your teeth bite together. And so here you can see what a healthy occlusion or a healthy bite looks like. You're going to see this term over and over again. So that's why I keep repeating it. Is you'll see here you have a proper arch shape, and the proper arch shape looks more like this, more like the golden arches of McDonald's. So looks more like that. And you have a proper arch width, which is between 40 to 45 millimeters. That's not really an important number for you to know, but there is a width that is considered to be healthy and optimal. And here, which is called the buccolingual inclination, I'm going to explain that in a minute. And here you can see what an unhealthy occlusion or an unhealthy bite looks like. You can see it's a narrow arch, okay, or you can see sigmoid, so it's either V-shaped or omega-shaped. And you can see an improper buccolingual inclination. And here you can see I drew some lines in order for you to see what a proper inclination or the proper positioning of the teeth look like versus an improper, which here looks like it's almost vertical, but here it looks like it's all over the place. Now, what are the different types of malocclusions, or what are the different types of improper bites or bites that are not healthy? So you can see here there are several. You have open bites, you have crowding, spacing, and spacing is huge, by the way, because you have a lot of plaque being trapped, and it's very difficult for you to clean between these things because, obviously your toothbrush, the bristles of the toothbrush are straight as opposed to being bent. And so it's very hard for anybody to maintain this. And I see a lot of cavities happening when people have spaces. Obviously, crowding is one of the main culprits for cavities and gum disease and gum recessions. Open bite is huge. Posterior open bite is one of the big ones for diffraction lesions. Same thing for anterior bites and deep bites. Deep bites are a huge one when it comes to compensatory eruption. You have overjets also. They are significant factor in anterior wear and also reverse or underbite. Now here you can see that was a diagrammatical sketch. This one here is more patient pictures. So you can see here, and I did warn you, I did tell you there are going to be some pictures that some people are going to find not too pleasant. And I hope you're expecting this from a dental lecture. So here you can see this is an open bite, and you can see there's fractures here. There's some, fraction lesions, bone loss here. There's root exposure, gum loss, bone loss. There's root exposure here. There's fraction lesions. There's a lot of these things happening, fracture of the teeth. You can see here, this is an edge-to-edge bite. Over time, what's happening is the teeth are just getting shorter and shorter. You're getting compensatory eruption where the teeth are coming down. They're actually starting to build more bone and gum tissue where it's not normal for them to build that. And here you can see there is a fraction lesions root being shown. And here you can see here, they've been to the dentist before because you can see there's fillings there, but you can also see that there's cavities. And the thing is that when you go to the dentist and you have these kind of things, really, like at this point, it's kind of just damage control unless you're looking to rebuild your entire mouth. With porcelain, you can see here, this is a moderate deep bite and a lot of crowding. And here you can see a severe deep bite where you can barely see the opposite side of the teeth. Now, talking about crowding in the lower anterior segment, here a study has found that anterior crowding of 3 millimeters or more serves as a risk factor for periodontal disease. So those people that are experiencing crowding also lend to risk factors of gum disease and bone disease, which is periodontal disease. And the source is here. So if you want to take a screenshot and go ahead and check it out yourself, you can go ahead and do that. Now, the problem is that 75% of adults, according to this study here, 75% of adults have malocclusion or have bad bites. Okay? And bad bites is one of these things or a combination of these. So crowding, spacing, deep bite, open bite. So same thing to what I just kind of alluded to here. Edge to edge, cross bite, and so on and so forth. 75% of adults. Okay, so 3 out of 4 people experience some form of bad bite or malocclusion, which is leading to all these problems that I was talking about. And the problem, even bigger problem, is that less than 1% are aware. And I'm hoping that with these kinds of educational processes, that a lot more people will be aware of this. I did, just kind of as an aside, this webinar thing was spurred literally a few days ago, so I didn't have enough time for me to let a lot of people know with regards to this. But obviously, with time, more people are going to get to know because I'm going to be doing more and more of these kind of awareness campaigns, so more people are aware of it. And here you can see that there's the data source of where I'm receiving these numbers from. Fraction lesions, and fraction lesions are the bane to my existence. And the reason is because once they happen, they are incredibly, very, very difficult to stop from happening unless you do one thing, which we'll discuss in a little bit. But once they happen, that's it. Like, you can't go back. There's no healing process. So it just becomes like we need to cover it. So once we see these things, the only solution to this kind of problem here is to put a filling. There's nothing else that we can do. So the point here is that to try to prevent them, or if you have them, to try to make them slow down the progression, because you don't want to have a situation where it becomes very severe and your teeth start to fracture. Now here you can see that there is a study here, and there's a lot of studies actually in this one. So if you want to take a screenshot to have a look at these studies, what these things, and I just kind of summarized them, is they basically say that the Latin origin of abstraction means to break away, and that's what's happening here. I'm going to show you in another slide exactly what happens in a diagrammatical sketch and what it means by breaking away. Okay, a study completed in 2016. They applied the theory that occlusal compressive forces, and don't lose me here, I'm going to explain to you in a second, and tensile stresses create tooth flexure in the cervical area. This is the cervical area here, or the neck area. Okay, that's what cervical area means. This is the neck area, which is the weakest part of the tooth, and result in microfractures of the, again, don't lose me for big terms, I am going to explain, hydroxyapatite crystals of the enamel and dentin from which a lesion is formed. So in other words, these here are called non-carious cervical lesions. So these lesions, there are non-carious, meaning they're not because of decay. Now, the irony here is that once you get them, you actually get more decay because the roots are more susceptible to getting decay than those that are not. Yeah, if you get a root that is exposed, you'll see more decay on roots than if your roots are not exposed. So in an article co-authored by Dr. Ben for the RDH magazine, he states abstractions are the result of the horizontal forces being placed on the teeth from malocclusion. And here you can see here the NCCL, which is the non-carious follicular lesions, are multifaceted, which we talked about previously. So it's important to understand that, yes, the bite is the major factor, but there are other factors as well. Now, this is what we're talking about here when we're talking about the compressive forces and tensile stresses, and we're talking about microfractures. This is what the sketch here is implying. So you have these microfractures happening at the neck of the tooth that is causing these abfraction lesions. And it says here, poorly aligned teeth can also create unnatural stress pressure on teeth and jaws. And you can see here how the fractures are happening, and they happen over time to lead to these kind of abfraction lesions. And these cause indentations, or what we term abfractions, at the gum line, and they also cause a lot of tooth wear. And this is the compressive forces that we're talking about. Now, it also results, and I just alluded to that, also results in gum recession and bone loss. Okay, so obviously at some point there was bone covering this here. Okay, but bone loss does occur over time when you have improper bites, when you have malocclusion, when you have improper forces being forced on these teeth, and you have these kind of abfractions being happening. And what you can see here, and this is the vector force. So this is the vector force here. So what you can see here is that you have tension, that's tensile force, and compressive forces, what we just talked about. And the reason why you get a lot of these recessions and you get a lot of bone resorption, a lot of bone disappears, because on the facial surface, or on the cheek side of your teeth, the bone is actually a lot thinner than on the inside portion, which is the tongue portion or the palatal portion. So yes, is toothbrush abrasion, is it a factor? Yes, it is. But is it a major factor? It's not a major factor. It's one of the factors. So this is the reason why a lot of people are experiencing these things. Now, why does correcting malocclusion matter? Okay, I'm beating a dead horse here, but just to kind of emphasize that it may cause tooth wear, right? These teeth in trauma, when they're in trauma, when you have these kind of forces that are not balanced properly, they do cause a lot of tooth wear, leading to sensitivity, gingival recession, clinical attachment loss, which just means periodontitis, or what we term bone disease, difficulty in cleaning teeth when you have crowding, leads to unsuccessful tooth restoration. So a lot of fillings start to fail, a lot of crowns fail. And it says here that, just to keep in mind that even when you have periodontal attachment, compromised periodontal attachment, so if you have periodontitis, when you have improper bites, it just exacerbates it, makes it a lot worse. That's what this sentence means here. So what if we don't address it? Now, these are extreme cases, except this one here. This is a mild case. But these are extreme cases. But have I seen them? Absolutely, I've seen them. Many times throughout my 10 years. I've seen these a lot. And this is incisal wear. And you can see here, this happens. And these aren't fictional. I mean, you can Google these, right? These are not fictional. These happen. And you have abfraction lesions. And you have everything I just mentioned. This is here. This is a combination of everything. Okay, so you have abfractions, you have gum loss, bone loss, you have periodontal disease, you have a lot of things happening here. But this is an extreme case. But I have patients that are in this situation. Okay, and so now they're trying to reverse it, at this point, and it is possible, but it takes a lot of work. So if you're in this situation here and you're looking in the mirror, and this is probably one of the things that I recommend for you to do, is to look in the mirror right away and say, hey, look, like, do I have these things? Do I have abfraction lesions? And more than likely, you do have abfraction lesions. And so when you go to see a dentist, they will more than likely point them out to you. Now, what's the wait and see approach? If you're saying to yourself, well, I'm just going to wait and see what happens. Well, if you wait and see, this is the type of stuff that starts to happen. You start saying this exact pattern that I've been talking about since the beginning of this webinar is you start getting compensatory eruption. You start getting here compensatory eruption. You start getting bone growth. You start getting gum growth in the opposite direction that it's supposed to grow. Teeth start to disappear. You start getting a lot of tooth fracture, a lot of tooth wear. You start getting a lot of fraction lesions. You start getting a lot of these problems. And it becomes very costly. It does. It becomes incredibly costly. In order for someone to go from here to here, I mean, the cost is insane. But, when people realize that, hey, look, like there's no other way for me to fix this, then it becomes, it's a matter of choice. and there isn't much in terms of option to restore this kind of function. So before you get to this point, this is what the whole point of this webinar is. There's another example of the wait and see approach, and it's just to give you an example of what compensatory eruption or compensatory eruption looks like. So you can see here, because there's no opposing teeth, and I'm going to explain to you more diagrammatically in a second, you can see the teeth keep shifting up. So how does this happen? Because of the lack of anterior contact, and again, this is an extreme example, but the reason why I'm pointing this out is to show you that if there is no contact on the opposite side of the teeth, what happens is that these start shifting upward, and that's what's called compensatory eruption. And so what happens is that you start getting these things start to tilt. So I'm going to go back, and I'm going to go forward. You can see here, look, back, forward. You can see how these things start to tilt, and they start to rotate. And then you can see this here is exactly what happens. So you got rotation, and you got tilting. Okay, so and then you have compensatory eruption, you have root exposure, you have, and you can see like you have, you know, fraction lesions here. There's a lot of things that starts to happen when you have a bad bite. Now, what's the solution? I know you're sitting on your seat and you're holding on. Like, what's the solution, Dr. Spinati? Well, the solution is orthodontic therapy. Okay, and this is what we're getting to. Okay, so some of you have gone through orthodontic therapy, and I applaud you for that because you definitely saved your teeth. You saved your teeth, and then you saved your gums, and you saved the health of your mouth. And so orthodontic therapy comes in two different forms. Okay, so there isn't a third form. There's two forms. There is braces and there's clear aligners. Okay, so or Invisalign. Now, the majority of my adult patients, they go through clear aligners because obviously they're adults and they don't want to be hindered in terms of their lifestyle. And so clear aligners have gone a long way, and they're very comparable to braces. Some clinicians actually only do clear aligners. And so what they do is that they fix your occlusion, right? They fix your bite. So all the problems that we mentioned is to fix your bite so that you don't encounter, so that you decrease that chance of you encountering those problems significantly. And it balances your bite forces. It's very discreet, very, very discreet. As a matter of fact, because people are switching it every week or every 2 weeks, those clear aligners, they actually tend to forget how they started. And so when they come and see me, and I show them the before and after, they're flabbergasted. They're like, wow, this is amazing. I knew it was bad. I didn't think it was that bad. Because you forget over time. That's why it's so discreet that you tend to forget that these shiftings are happening, but they do. And dramatic results happen. And it takes approximately 1 year on average. Some people, whose teeth require a lot more shifting, it does require more. But on average, it's around 1 year in treatment. You can still enjoy your foods that you love. And most adults, they do prefer clear aligners. This is the befores and afters of some of the patients. Now, this patient here, you can see there's a lot of crowding here. Her teeth were retroclined, or the teeth were going towards her palate, as you can see here. And the after here, you can see everything is straight. The buccolingual inclination is very nice, and the teeth are very nice and balanced. She said here 1 year later, I'm so happy I finally did this for myself. This gentleman here, young gentleman, he said around, you can see here, you can see the same thing. So you can see the teeth here are inclined palatally or going towards the palate. You can see here the teeth here, there's crowding happening. There's crowding happening here and here. And you can see the aftermath. Very, very balanced, very nice bite. And he said around 2 years, so this gentleman, it took him 2 years, around 2 years with some filling and bonding done at the end. If you're questioning getting Invisalign, do it. And this person here, okay, so this person, and again, orthodontic treatment is not, it's not in terms of the time frame. There's no set time, because it really does depend on your biology and your age. There's a lot of factors that would determine how long you'd be in treatment. But you can see here, this person was in treatment for 20 trays, and she had a little bit of reshaping for her teeth. And now she says, now I smile more than I ever have. You can see here, she started with severe crowding on the top and the lower. And you can see the after here, dramatic results. Same thing here with this gentleman. He says here, we're done, baby. And here you can see a lot of crowding. His teeth were all over the place. They were not in the proper arch form that we started with. And here you see there's crossbite, and here's the after. So yes, aesthetically, all these patients, obviously aesthetically, they look much better. And in science, we say form follows function. And so if the form looks good, usually the function is also good. So if you see someone that is, you see someone who's training for the Olympics, more than likely they're very fit. So if they're fit, more than likely they actually perform well, as opposed to someone who's not fit. So same thing here. When the teeth are fit, they function better than the teeth that are not fit. And this here, again, you see crowding. Here you see the crowding is done, a little bit of teeth whitening. And she said, I'm done. Permanent retainers on top and bottom too. It feels amazing. Now, what's the clinical protocol? So if you do have these kind of things that are happening, or you're looking in the mirror and you're like, oh my goodness, I do have these, these abfraction lesions or these things that Dr. Spinati said in the webinar. What comes first? The first thing that comes is your gum health, your gum and bone health. So that's the first thing that needs to be resolved. And then if that's resolved, or in continuation with it, you can start your orthodontic treatments or clear aligners. And then after that, you can go ahead and do the restorative treatment, because the restorative treatment would be in line with your current or your new bite. Now, before I go on, are there any questions from the field? Do we have any questions? We've been on now for 31 minutes, and I did promise you it was going to be around 30 minutes, so I didn't break my promise. So any questions? No questions? Okay, no problem. So let's go on. We have so everyone here that's watching it is watching from StreamYard. So I do appreciate your time. So thank you very much for your time. Now, if you are watching this and you're thinking to yourself that you're interested in wanting to pursue this form of treatment, orthodontics, I do have, and for those people that stuck with me until now, I do have an offer for you and some bonuses, specifically for those people that attended this webinar. So are you ready for this? Okay, let's jump into it. So what's the offer? So this is the offer. Okay, now the offer is this. If you book your appointment now using this link, so the link is here, and I will type it in the chat. So let me just do that now. So if you go ahead and you book your new patient exam now, this offer and the bonuses that come with it, they will apply to you if you go ahead with orthodontic treatment, of course, if you need it, right? That's why you have to do the assessment first. So this is it here. So you can copy it, and you can go ahead and register. You'll receive 10% off of your clear aligner treatment, should you choose to get it, and if you're a good candidate for it. So there's a lot of ifs there, but this offer is for you if it applies to you. And if it doesn't apply to you, you can pass it on to one person, a friend or a family member who has not attended the webinar. This is the exception, okay? That you can pass along to that person, but that person must book their appointment. Okay, so there's more. Okay, so there's more. Now, the value for that is $700, 10% off of the orthodontic treatment. You also get, the bonus number one is you get an electric toothbrush, which is valued around $300. I think Amazon is selling it for around $400. But there's more. You also get 2 cleaning sessions, including a polish and fluoride, which is valued around $600. I think it's valued more than that, to be honest with you. And you get a opalescence boost in office teeth whitening. Now, this here is a total value of $2,000. Now, it's not meant to be a salesy thing, but this is just meant to encourage you for you to seek help with regards to your bite, okay? So that your bite can actually be better, so that your oral health can be better. So that's the incentive. So this is the incentive, but keep in mind, this is only for this webinar only. And this is not an endless, kind of promo. This does end at the end of the webinar, and you must register or must book in before the end of this week. And you must let us know that you're the one that attended the webinar so that we can apply that offer and bonus and honor it for you. But the other caveat is that obviously that you have to go through with treatment in order for you to get all these bonuses. So there isn't like a cherry picking of treatments. So that's it. Thank you so much for attending, and just letting you know that I do need to emphasize that I am holding these webinars every week or every 2 weeks, but it's not going to be the same kind of offer and bonus, right? So keep in mind that there's no guarantee that I'm going to have the same thing next time that I do these types of webinars. So just keep that in mind. And by this Friday will be the cutoff that I'll be able to honor this bonus and offer, kind of give you an incentive for you to jump on the bandwagon to better your oral health. So if you have any questions, please let me know, and I will be more than happy to answer them for you. Thank you so much, Nancy, for your comment. It says, thank you so much. You said, very good webinar. Thank you. I'll be looking forward to meeting your husband. If you have any questions, if no one has questions, then it was a pleasure spending time with you on this day off, on Labor Day weekend. I hope you're having a fantastic long weekend. And if I get to meet you, I hope I have the privilege and honor of helping you with your oral health. Until next time, keep yourself well and keep smiling.